I think we're live now. Let's see how it goes.
Perfect. Okay.
We're live now.
Yeah.
I think we're live. See how it goes.
Yeah. Hi, everyone.
Perfect.
Wonderful. All right. We are right live here again with just a few minutes of glitch.
Hi, everyone. Perfect.
Okay.
Wonderful. All right. We are right live here again with just a few minutes of glitch.
Okay. Another glitch, and we are good now. Perfect. Hi, everyone. My name is Ruchi. I am one of the OCE leads with Final Frontier, and we are here today with our entire team to talk and discuss a lot of different new changes coming along and how you can still make it. I will hand on to our one of the leads, and Nikita, she would introduce herself.
Hi everyone, my name is Nikita and I am another instructor with the OCE Final Frontier. We are happy to be live today and help you guys with any questions or concerns you have about the new changes coming up in the October OCE exam. And we would also introduce Samarth. He would be joining us as another team member. So I'll just hand over to Samarth.
Hello all, myself Samarth Shah. I'm one of the mentor at OCE Final Frontier. I'm newly joined member, but yeah, I do have some experience of working with the students. And again, I'm happy to be a part of a team. And thank you for all the students for being here and listening to us. There will be so many details that we're gonna share today about your upcoming OCE exam, which is again the game changer for all the PT residents. So hope you all stay with us and yeah, just find all this information very much informative and get back to us if you have any doubt.
Thank you, Samarth. We are very lucky to have you on our team. You are bringing immense experience helping on all our students and being a strong support with all of us.
Pleasure.
But a fun fact to mention here before we move ahead, Nikita is our new mommy. She just gave birth 2 months ago and she's here demonstrating all the strength. And that's what we are here for.
Yes,
Go
true.
to Nikita for that. Perfect. So let's get started. Our goal or the aim for today is to come and talk and educate all of you on the different changes coming along and that there's nothing to be worried about. You don't have to worry on what's coming on and if you should postpone your exam or you should not go on. Nothing to be worried about. It's just a different change. You will still be tested on the same components, on the same knowledge, just in a different pattern. So that's what we're going to talk about. What is OCE coming up in the October? What are the changes and what should we be keeping in mind? You still have your two cases. To begin with, you have a case with approaching case one, you would be tested on your assessment skills and you will be tested on your goals and treatments very briefly because we have the second case or the second part of the exam that's going to test you in detail about the treatment and how you would carry forward monitoring the patient and finally discharge the patient. Now, while we have these two cases, we originally had 11 ethics scenarios or vignettes, which was quite different and would not test you in the scenario that you are in. This new format brings us where your ethics is tested while you are actually in the situation or in the scenario that is testing you for both the cases. So that is the basic understanding. The timings are going to be the same for the exam as it is what it was previously. It's just the cases are expanded and your ethics knowledge is tested differently because CPO believes they want to understand how clinical and logical a candidate is and how differently they can act in a situation in terms of their ethics as well while they are keeping their physiotherapy component in mind because they are not looking for any kind of puppet answers or verbalized answers or answers that are just muggified with the standardized reply. And that is the major change that is coming along. And you don't have to worry anything about that. More details about specifically how it's going to be covered, we will be covering during our first OCE live lecture that is being conducted on 13th of July. So if you are watching this, if you are someone who wants to know more and exactly what it is going to be, please send us an email and we'll be happy to send you the link. You can also sign up on our course page and you can sign up. You will be receiving the details on how you can sign up for that lecture. Plus, that was just about how this exam is going to look like. We don't stop here. We do talk a lot more details. I want to ask Nikita, from your experience of being with the students and from your experience of coming along, what are the tips and strategies that you would tell the student not to do while preparing and also while they're giving their exam? What are the things do you think would be a great added valuable resource when you're telling them not to do those things?
Right. So, first thing is like when the PT resident, because they cleared the PCE when they were preparing for the PCE, they used to read a lot of content part. So now OCE is different. They are testing your clinical skills. So there is no point of go back and read lots of book. It's more about showing your clinical skills now. So you need to have like a good idea is like how would you be conducting your assessment rather than again go back and read all your notes. You know your knowledge, now apply those knowledge and like how would you do, for example, case one. So assessment. I like when the student comes to us is like, okay, I started reading this. I'm like, but there is no point of reading at this point. Like now just understand that whatever you read, those information, where would you put when you do the assessment and how to verbalize it. We have come across many students, they are preparing by themselves. This is the exam where you have to practice how to talk. If you are very good PT, if you are very good as a taking the assessment for the patient because you are working as a PT resident, but you are not very good talker, because like when you go for the exam, it's like actually you would be explaining as a to the third person, right? So that is the most important thing, that you have to make sure that you do practice rather than just kind of keep writing the scenarios, because this is the case scenario based clinical examination component. So make sure you do this rather than just kind of preparing by yourself or preparing alone.
Yeah. I think when you tell us, it is also so important to remember again, this is not OSCE anymore. It is the OCE. You're not going to be standing at the live stations or doing any kinds of hands-on activities. It's more of verbalizing your answers and always expressing a why. It's important to explain why you think the so-and-so answer is what you're supporting, or why you're giving that answer and how is it going to help you in the situation. Because a lot of the time students would verbalize what the answers are, not supporting them with a why. And that is another thing I feel that they should not be doing. It's important to support with a why. Yeah. Samarth, would you like to add anything to that? What would
Yeah,
you?
for sure. Like when another thing that we have to keep in mind is try not to repeat the same answer again and again. Like even though like you get confused, you get lost, just try to take a pause. Just let the examiner know that, okay, I just need a minute to kind of reframe my answer or kind of add on more detail. And they are always open to that. Okay. But like many students, they just kind of, okay, it's coming, and they're going to just repeat it again and again. Number one, that doesn't create a good image in front of examiner. And number two, like chances are there that examiner might think that, okay, you don't have any ideas or you don't know the answer. So chances that they can probe you more, or they can just kind of skip the part and you can lose your mark. So try your best to kind of go thorough with your answer at a good speed, like not too fast, not too slow. And if you get lost, just take a pause. Don't get nervous, and it's just an exam. So you can anytime you can kind of get back to your answer and just take a deep breath at the time. Yeah.
That is so true. When you said that, I was like, oh my God, we tell this to our students so much and all the time. Don't repeat your answers, because it's like if you're having a question asked and you are answering that question, if the question is repeated to you, please understand the examiner did not have the information they were looking for. So don't try to repeat or reframe the same answer. As you said, Samar, that is so right. Take a moment. If you take 30 seconds and if that avoids another probing question, I think that's the best part, and that you can successfully lead on to the next question.
Definitely. Yeah.
Perfect.
I would like one thing from the Samarth point. When you say that don't talk too fast, I just realized that the students who are talking too fast, the examiner could not comprehend like what the student is saying. So in that case, you would lose your points in the communication domain when the examiner is also not able to understand what you are telling them. So you have to be slow. So the word you are saying, they are able to actually like hear them and then understand that what you are actually saying. There are few words like those words like maybe you are not able to pronounce like proper like more efficiently. That's okay. Take some time. They are not looking for your perfection in the pronunciation, right? They are looking for that what you are exactly thinking. So that is my another recommendation. Those students who are like a fast speaker or fast talker, just for the exam, slow it down.
Yeah. And one more thing, like if I can add on here, like many times like students try to divert the answer. If they don't know the answer, they just kind of go off track and try to kind of play some games with the examiner. And I'm like, no, that's something you always try to avoid. If something is given to you or being asked to you, you kind of stick with that. Okay. Like they can clearly understand that, okay, this is something you kind of going off track. So again, that's not, well, I won't say that's not allowed, but again, that's your exam, right? So you just want to stick with your answer. You want to stick with the information provided to you. So that's something we always keep in mind in order to get more marks, as well as like kind of not to have too many probing questions with that information.
That is so right. Moving on to, we spoke about what things not to do. Can you guys talk about the things that we can actually do?
Staying calm. I know
Perfect.
it's really the time when you get super nervous, you feel like, okay, all my nerves are at the roof. But again, that's not going to help. Okay. So, like, kind of taking a deep breath, relax yourself, maybe having a glass of water, if there's some strategies that you can use, like just to help yourself calm down. That's something we can always use. And yeah, as we say in our classes, right? Like, always practice in front of video call or with your partner, right? Like, when you see someone and then talk is always different when you just talk by yourself or record yourself. So I guess maybe practicing in front of someone else, or maybe record yourself in front of laptop and then seeing the same video can also help you to find out your mistake and not to have the same mistake in the exam. So maybe that could be a very good strategy to feel prepared or feel like confident in the exam.
Yeah. One of the very common feedback that I've received, and when I talk this, I want to bring forth that we always learn from experiences. We learn from our experience. We learn from someone else's experience. So this is a combination that I'm bringing up this thought here. Please don't listen to the people who have told you that OCE doesn't need any preparation or it is very easy. I have people in two situations. Either they have failed their one attempt, or they are just 10 days ahead of their exam and they don't know what they're doing. And they panic and they don't move around well. And for the most part, the results are not in their favor. I strongly believe, and I think Nikita is also going to support me. I think Ravneet and Samar, they all are going to support me with that. Failing OCE is tough. It's not easy to fail OCE. If you're doing the right things, it's very good to pass, and it's a good one to pass your OCE. It's tough to fail your OCE. You really have to do something to fail it. But if you do all the right things, you're going to pass it with a proper platform, with proper guidance, how to speak, what not to speak, how much content to cover, what not to cover. Everything, if you're guided in a better pattern, you will see the right results. So please, if you're listening from someone who's saying they passed without any practice, maybe they got lucky. I'm sorry. You need preparation. And if you don't know how to verbalize, if you don't know how to speak, if your brain, or if even if your mouth is not ready to speak for 3 hours, you may not be able to survive that exam.
And
So
also understand that if they pass, maybe they would be the good talker, or maybe they would have like those communication skill, and they utilize their experience from being working as a PT resident, because that's what the case one and case two is. You are doing like if you are seeing 4 new patient a day, that means you are doing assessment 4 times, right? That means you are doing the case one 4 times a day, case one practice. So in that case, Yes, but that does not mean that you would consider that, okay, you are prepared for that. At least you want to put yourself into that situation. That's where the OCE Final Frontier, you connect with us, like you connect with one of the mentor, you connect with like our whole course and understand that, okay, are you fulfilling all these criteria? If you feel that, okay, you are confident enough, maybe you can. But most of the time, being the PT resident, you are having some kind of mistakes happening somewhere. That's what you have to fulfill to become the registered physiotherapist.
Absolutely. Samat, would you like to add anything to
No,
that?
like I pretty much agree with what Nikita said. Like definitely with our classes, we always prepare them in a right way. We give them a right direction, and that's why we are here for, right? We always want our students to pass. We don't want anyone to fail because failure is not something we're looking forward to anytime. And as you mentioned, Ruchi, like failing this exam will directly put you at a PTA level, right? Like even you will lose your residency license. So again, you work so hard to get here, and again, one small mistake, we cannot afford that, especially when we are so much closer to our goal. And that's our goal, to help the student with all, by providing all the necessary details, giving their tips based on our experience, and with our all the resources that we offer through our classes, such as like one-on-one tutoring and the mock exam. And they are like more than enough to kind of feel prepared for your exam if you work through it and if you kind of go through all the material.
Right. Two key points I would actually pick from what Samat said. The first part, going back to working as a PT assistant or a flat rate or a basic rate pay job after being a resident PT, we focus this point so much with the students that you want to take this seriously because it's either as registered PT or back to being a PTA. There's nothing in between. And that again brings in a lot of added stress. There is nothing wrong to work as a PT assistant. It's a good job if you are at that level, but you have worked extremely hard. This is not the time to take anything for granted. That's extremely important. And talking about the mock exams actually that we offer, the most amazing part I feel is a exam that is exactly similar to what the pattern of CPO has offered for the OCE. We do a good 3 hour exam, a full-fledged complete exam with all the questions in it. And we do another 1 hour review, which we usually target to be done within 24 hours. Because 24 hours, our goal is your mindset is still fresh. You know what you were thinking about and how you framed the answers and what mistakes you made. With that review, you are able to understand the changes that you can work on and how you can progress and be on the other side of the line. So that's another beautiful support that you receive from us, and we are very happy to support you on that. Wonderful. Any other things that brings to the highlight for your from you guys in terms of the experience of the students and what you still want to recommend to everyone out here?
I guess most of the students have come in and telling me like our ethical scenarios, right? The way we teach them the ethics is kind of really helpful for them into the exam. So do you mind, Ruchi, to kind of put more light on our ethical things, like how many lectures we usually take?
Right. So with the changes in patterns, we have made sure not to change the content of the ethics. We cover 4 lectures. They are in depth, covering all the ethical scenarios and standards, completely highlighted and taken from the CPO's websites, covering everything. While we do that, we are also going to be adding ethics-based scenarios in between the cases as well, because that is actually going to bring us on how to stimulate your brain when you are in that situation. So with the ethics lecture, your entire content is being cleared and covered. With the other content-based lectures where we are covering all the cases, we will be covering ethics alongside with that, which again stimulates your brain, as I said, on how to act in that particular situation. So that's how it's going to be. That's such a great question. Thank you for asking that, Samar, because I'm sure so many people out there have this question and they're going to be happy with this understanding or that clearing their doubt.
Yeah, for sure.
Wonderful. Any other closing statements that we have?
Mm.
Hi,
Yeah.
Ravneet.
I wasn't sure if I'm allowed to speak. I didn't have my opening statement, so I don't know if I should give my.
You don't
closing
need any
statement.
introduction, Rajneet. We all need introductions. You don't need any introduction.
I was just no, it's great. It's the best team to work with. You guys come with compassion. You guys come with empathy. It's a judgment-free zone. So if anyone who have had struggle to pass PCE or OCE and have been struggling with how people are reacting towards the level of preparation that they have, I think it's a very safe space to talk about. And I'm very proud of you guys. You guys are doing a great job. We've had 100% pass rates for the OCE so far, and which is great to see because as you guys were talking about that it's not difficult to fail the exam, but also with the right mindset. And I've always believed that, like, you know me, like it's all mind game. You all have been good with English, you all have been communicating in English and talking to your patients, right? So one day you have to sit there in front of the camera on your screens justifying your answers. Again, it's a perspective, the perspective that you take. How we complain about multiple choice questions. I wish I had a chance to justify my answer. You get a chance.
Yeah.
It's OCE, go for it, right? Get a right training and get the right way, get the right things to talk about, and just say it confidently like you're talking to another PT.
Exactly. This is
I
so
rest.
this is so
Yeah.
perfectly placed. Like we all want a chance with our MCQs, and now we have a chance.
Yeah.
That's amazing. Um, with this, I feel it was a great conversation amongst all of us, and we covered really good details, which brings in lots of light to the new information right out here where the students are confused. They don't have a lot of understanding what's coming along. I would really like to invite you all to come and join us for our first free live lecture on 13th of July. Come and understand more on what it is going to look like. Come and understand the examples on what it looks like. Come and understand and listen to our mentors, instructors, and see what they have to give to you. And then let's meet in our live classes after that. Perfect. Give us an email. Send us an email. Give us a shout. You can always DM us on our Instagram page with the OCE Final Frontier, or even PCE Final Frontier will be reachable on both. You can send us an email that's on your comments section here. And that is something, just one email we give you, we send you all the information. Otherwise, just to even keep it easy for yourself, you can as well just log into our course page and sign up for the free lecture. That's all.
Yep.
So many different ways to help yourself, allow us to help you. Help yourself to allow us to help you is what I'm saying. Just one step, and we want to see you on the other side.
That's true.
Perfect. Anything that Samat and Nikita would like to say before we get to say bye?
Let's connect for the first lecture and let's pass OCE all together and see you on the other side. No more money draining, then is the money making business afterwards.
For sure. Yeah, and yeah, for sure. Like, I highly recommend all the people, whoever is watching this video and not watching, or maybe finding it later on, to come and join us with our live lecture and learn more about the new changes. Give us a chance to be a part of your success journey. We are here to help. So yeah, see you all there on July 13th, 2015. Stay tuned.
Perfect. Thank you, everyone. Thank you for this wonderful weekday evening and watching us all. And we look forward to see you all during our live lecture.